And then
Oh yeah.
This is gas.
No, this is gas. Yeah. A bit muddled up, I guess.
Well, these are the gas. They just don't have the house yet.
We're wrapping our extra instruments in case the surgeons have a mishap with them or they become contaminated. We'll have extra that we can just open up and give them. In every peel pack, we need an indicator to ensure that a proper full processing has got hot enough to kill all the microorganisms. So this little strip here, you can see it. It's yellow right now. It'll turn green if it's had enough sterilization. And this tape here has some white lines. It'll turn black. We just throw our thing in and seal it up. And we write what we need, what we have. And then they throw it in the cooker or a steam sterilizer, which is in the other room there. So this is a steam sterilizer. I actually don't run one of these, but I know how it works. And then there's this little tape and it spits out the temperature it gets to.
They're doing the baby in there, 2 years old, little girl.
We're working on a child with a clubfoot which has been corrected, except for the front of the foot is deviating off, and so we're transferring a tendon, and we're also cutting one of the outer bones to straighten out that foot. Put some pins in it. The tendon transfer is, interestingly, we'll take the tendon, move it to a new place, and make a little hole in the bone, and then run the tendon into that bone, and then put a button on the bottom of the foot, and run sutures through the button, and then at 6 weeks we just cut the button out, and that hole is a tendon in the hole that it was created in the bone.
The girls have a general anaesthetic, and when we get to the end of the procedure, I'll do a caudal anaesthetic, so that'll keep her nice and comfortable on the ward for the next 4 to 6 hours. And then she'll just be able to go on to some orals.
I'm Dr. Liang. We just finished doing a total hip replacement on our first patient of the day, and the surgery went well. We first make our exposure and get done the hip. We dislocate the hip, we cut the femoral head off, and then we clean up the soft tissue in the acetabulum. We use reamers to ream down some bleeding bone. Then we put in an acetabular component, that's the cup part. And then we also use a screw to hold it in place. Then we put a plastic liner on the acetabulum component. And then we turn our attention to the femoral side. We use reamers to make a pass down the canal and put in trial components, put the hip back to see how it fits, and then we put in the actual components, and then we close.
Second patient, Julio Armando, and we're just going to start his intravenous out here in the pre-op area. We're just finishing up the first case from this morning, so we're going to give him a little bit of fluid because he hasn't had anything to eat or drink since midnight, which is a standard of care. And then we're going to finish checking through all this paperwork and bring him through when we're ready.
¿Está excitado que va a tener una cara de visita nueva?
Sí, estoy contento, alegre, y agradecido a ustedes.
Ah, muy bien.
So this is our first case of the day this year, and it was a little clubfoot that we have to correct the front of the foot, the tendon transfer and a bone cutting procedure. Everything went very well. They put her in a cast that goes to above her knee, and that she'll wear for the next 8 weeks. At that point, then she'll get out and get going, and she should be good. And we'll see her again at clinic next year.
We just brought a little cutie from the OR. We're gonna recover her. We need to make sure she's doing okay before she goes up to the ward. So we want her to be awake. She's quite sleepy right now. So we're just going to kind of help her breathe with some oxygen, check all her blood pressure, her heart rate, and then when she's awake and everything's looking good, we'll send her upstairs.
Pressão 5 minutos. 5 minutos, 5 minutos. Celia just came out of the operating room, so we're just going to make sure she's stable, that her vitals are good. that she's not having any pain, that the operative site looks okay, and then as long as everything is looking good, then we will send her up to the ward. So the other thing we want to do is because they get spinal anesthesia, is make sure that the block level, or the point at which they don't feel anything is dropping down over time.
Gracias por todo. Todo muy bien.